Hello everyone. Hello everyone. Good evening everybody. A warm welcome to all of you to the Facebook viewers. My name is Dr. Praveen Subudhi and I'm working in Rubia Hospital in Berhampur, Odisha. So I'll be talking something about today about the dry eye disease, which is a lot of people are not aware of. To make you aware of what dry eye disease is and what are the steps we need to take care of our eyes. As we are facing the biggest pandemic of the century and we are in the advanced shutdowns and lockdowns, this problem will be aggravating more and more. So we need to know what are the things we need to do so that we can keep our eyes as healthy as possible, because as we know, eyes are windows to the world, and if you don't take care of your eyes, you will always face trouble. Hence it's very important to have a healthy to give healthy respect to your eyes. This is my biodata. So I did my MS and then I did my DNB and FRCS from Glasgow, Scotland, and I'm basically a cornea surgeon. Then I do a lot of transplants. So I have around 21 publications in various national and international journals and around 30 citations I have. And I'm a reviewer of clinical ophthalmology and corneas. Before starting this presentation, let me show you this video, a small video.
The reflected light of the world enters through the crystal transparency of the cornea, aqueous humor, lens, and vitreous humor to project onto the photoreceptors of the retina, whose impulses converge on the optic nerve, and then to the brain to be transfigured into imagery and imbued with meaning. In today's world, the eye's surface is constantly challenged to protect itself and adjust to changing conditions. Every blink helps our eye's natural defense system, the tear film, retain moisture and maintain visual acuity. Tears contain potent natural disinfectants to keep bacteria at bay, and the tear system washes away impurities to maintain eye health. The miraculous biology of our eyes inspires us to develop ways we can protect and maintain comfort for these remarkable structures. For all the wonders our eyes provide throughout our lives, we owe them our attention and ongoing care.
So you can see in this video the ocular surface, that's the cornea, which is the transparent structure of the eye, plays a very important role in transmitting the light inside the eyes. But more importantly, this cornea is irregular. It's not a regular surface. It has very much irregularities. If you can see this photograph, when we analyze the cornea in a two-dimensional form in a paper, we can see these type of color codings. And in this color coding, if you could see, there are certain plus and minus numbers. The plus means that there is elevations and minus means there are depressions. So as I said, the cornea is not at all regular. There are a lot of elevations and depressions. And whenever there is elevations and depressions, when the light rays are falling onto this irregular surface, the reflections of the light will not be proper. Hence, the image will not be proper. So what we need to do, what the God has given us and what nature has given us. The nature has given us this tear film, the water film, which is present on the ocular surface, which makes the surface very regular, and hence the light reflections over the surface makes very smooth, and we get a clear image. Whenever a person has a poor tear film, these irregularities of the cornea will be surfaced, and the patient's whatever the image formation will be there will be poor. The patient cannot see a good image. Patient will have a lot of blurring of vision. So what is a tear film? This is the tear film which is present over the ocular surface. You can see in this photograph, there are 3 layers of tear film. The outside layer is the lipid layer, which we say lipid layer in Other words, we say it as a cholesterol or fats. It's in And second layer is the water layer or the aqueous layer, and third is the mucus layer. A balance of these three layers are very important to maintain a good tear film. Whenever this balance is lost, the tear film becomes irregular and all the problems come out. And we need to have healthy respect to all these layers. And whenever we treat, as an eye doctor, as a cornea surgeon, when we treat these patients, we need to treat to the individual layers. So whenever you have a good tear film, a normal and a stable tear film, you will definitely have a clear vision and you will have a good ocular comfort. But on the contrary, when this tear film becomes unstable, or when the eyes become very dry and the tear film stability is not there, then what you can see, you will have a blurring of image. When on the left hand side of the picture, you can see the image. When a person with a good tear film, the letters he can see very clearly. But on the right hand side picture, if you could see, the letters are very blurred and irregular. So the patient having an insufficient or a defective tear film will have a little bit of poor image. And what are the other symptoms you need to know whenever to see whether the patient is having a dry eye syndrome or not? One thing is very important is the higher sensitivity to light. What do you mean by higher sensitivity to light? So whenever you go out, when you due to the sun rays falling into your eyes, you will have a lot of discomfort. So whenever you're having a lot of discomfort or a higher sensitivity to light, then you are dealing with something related to dry eye, and you need to consult the local ophthalmologist. Discomfort in the windy condition, whenever the wind is flowing, because as you know, this is water, and when the wind is flowing, if you have an unstable tear film, the water will become dry quickly and you will have a lot of discomfort. Third, the most important thing, when you read or when you watch a computer or a mobile, you have a lot of irritation and discomfort and itching and foreign body sensation. Whenever you encounter irritation, itching, foreign body sensation, discomfort, and higher sensitivity to light, then you are dealing with something related to the tear film. Besides eye pain, a simple eye pain, everything is fine. Your eyes are looking white. Everybody says your eyes are fine, but still you are encountering eye pain. Then you are dealing with something related to the tear film or a dry eye syndrome. You need to check whether you are having a dry eye disease or not. If you look at the epidemiology, this is the global epidemiology report, that is the TFOS, that is the Tear Film Ophthalmic Society or the Ocular Surface Society, which has conducted the epidemiological study among the general population, how much dry eye disease is prevalent. You can see the percentage, it is around 5 to 50%. And women have a higher prevalence. And Asian ethnicity, that is like we Indians, have a more risk factor, like genetically we are more prone. And this dry eye disease has a deep economic burden, and it will lead to a poor vision, a poor quality of life, a less work productivity, a psychological and physical impact of pain, and all these problems will be there. If you decode this abstract, 1 out of 3 to 4 individuals or 2 individuals are suffering from dry eye. Females are more affected. Racial genetics, that like Indian genetics and all these genetics are there. Asian ethnicity has more prone for dry eye syndrome. As I said, we are facing the biggest pandemic of the century, and with the lockdowns, shutdowns, this incidence and prevalence of dry eye will be exponentially increasing day by day. The reason why? Because as we have so much of free time, we are constantly hooked to our monitors, or we call it as visual display terminals, like computers, mobiles, iPads, laptops. We are constantly hooked. Either we are working, because nowadays the students, because of the school shutdown, they are going for online classes. And even the persons who are IT professionals who are working from home, they are seeing computers for around 10 to 12 hours per day. Besides their work also, they now watch movies, they see the social media, and all these things are seeing the screens. Like we are hooked around 50 to 60% or more than that, 70% of our wake up hours with screens. And because of the screens, we are also having very unhealthy diet. We are eating a lot of fatty foods, we are eating a lot of junk foods, and all sorts of nonsense foods we are eating right now, because while sitting we want to enjoy. And this pandemic has caused a deep economic impact on our families. The businesses are not running, the money is less, and this has led to psychological problems like depressions, anxiety, post traumatic stress disorder, and all these complications has also an indirect impact on dry eye. And why so prevalent? Because of our poor lifestyle, unhealthy eating habits, and our poor mental state. And these are the things has already been published in various literature. So in this article you can see dry eye disease in a Korean population. They found that there was high serum cholesterol levels in patients with dry eye disease, and the results of this study highlighted the significance of eye examination and independent lipid profile monitoring in patients with dyslipidemia because of its possible correlation with dry eye disease progression. So that means dry eye disease and lipid profile or cholesterol, serum cholesterol, that the blood cholesterol level is an independent risk factor for development of dry eye. As I said again, the psychological aspect, because a lot of people are now suffering from depression because loss of work, loss of pay, and a lot of other factors, and this has led to a lot of dry eye disease. And there has been proven that there is a definite association between depression and dry eye disease. And whenever these people consult a psychologist or a brain doctor or a mind doctor, they will be prescribing antidepressants. And sometimes these drugs has also an indirect impact on the ocular surface or on the tear film. And this vicious cycle of dry eye disease, depression, obesity is going on and on in this COVID pandemic. So now it's very important to do certain things during these COVID times so that we can keep our eyes very, very healthy. And you need to understand these slides. The next few slides is about what are the things we need to do so that we can keep our eyes healthy as much as possible. First thing, I would request all my Facebook viewers to tell their children to have a time limit of visual display terminals to see the screens. Try not to see more than 30% of your wake up hours. Like if you're waking up for 16 hours, don't see beyond 4 to 5 hours per day. For children, if they want to read, it's better to read a hard copy rather than read a soft copy. Discourage your children to see any form of movies on a screen, and don't give them mobiles. A lot of patients come to me, tell that my child is always addicted to screens, but I always say one thing: where did they get mobiles? Did they buy it? No. It's as parents, as we have given these mobiles. So now it's our priority, our responsibility to snatch the mobiles from them. And as adults, and even today nowadays, the geriatric people, that the old people, like people beyond 50, 60 years, are now the new persons who are hooked to screens, and they are so much of addicted to the screens. It's very dangerous, and in due course of time we will be dealing with another pandemic of dry eye disease. Another thing, most important thing, the geriatric population, that's the people more than 60 years of age. Naturally, these people have a dry eye disease because the tear production from as I shown in that video, the tear production from the lacrimal gland will be slowly getting reduced day by day. And as we reach 60 years, 70 years, naturally our eyes will become dry. On top of that, if we see the screen, the dryness will aggravate and the patient will have lot of problems. As I said, the symptoms will be itching, irritation, foreign body sensation, reflex watering, and these patients will be always telling there's a lot of watering. That watering is not the good watering, that is the bad watering. That's also a symptom of dry eye disease. And whenever you see the screen, follow this 20-20-20 rule. For every 20 minutes, take a break of 20 seconds and see an object that is 20 feet away. That will relax your eye, and that will help your tear films to keep healthy. Diet is again a very, very important component of dry eye disease. Whenever we eat, we should have an ideal balance of diet. Like we should have an ideal balance of carbohydrates, proteins, and healthy fats. Healthy fats like these almonds and all these are very healthy fats. But when we should never eat deep fried foods. Deep fried foods are rich in cholesterol and trans proteins, and these are very dangerous because this will eventually lead to a poor lipid layer. As I showed the tear film, there are three layers: the lipid layer, aqueous layer, and the mucin layer. The lipid layer will be poor. As you know, the tear film has three layers. The lipid acts as an insulation effect to prevent the water getting evaporated. And if your lipid layer is poor, the water will get evaporated faster and the patient will have dry eye syndrome. Exercise. Now, you need to have a healthy respect to your physical body also. As we are seeing screens, we are giving a lot of importance to our mental aspect, but we are never giving any importance to the physical aspect. For at least 1 hour per day, you need to have some core exercises like doing some yogas, and you need to have some stamina exercises like treadmill or walking or running. This will help your tear film because this will relax your eye muscles. And during that time, when you're doing a physical exercise, your mind and eye is not working. Your mind and eye is at rest, and this is the time your eyes will get rejuvenated to do a lot of work. So it's very important to have core exercises and stamina exercises per day, every day, at least 1 hour. Spectacles, again, spectacles, always use your spectacles because geriatric people, like more than 40 years people, they have a loss of near vision. They need to use glasses whenever they see a near object. And these people beyond 40 years should always use their glasses while watching the monitor, while watching the screens, because that will give the clear image and that will relax the eyes. If you're seeing without spectacles, your eyes are working very hard. Your eyes is doing a lot of stress. Your eyes is undergoing with a lot of stress, and that will cause dry eye. And whenever you are using, and in the kids, the children, they need to use appropriate power if they have power. Even if they don't have power, it is advisable to use a zero power anti-reflective glasses whenever they see the screens. And you have to have an adequate and the proper power when you see the screens. For example, if a person is having -2 diopters power, and if he's using -1, then his eyes will be under strain. In that case, the dry eye syndrome will be aggravated. So it's very important to use your spectacles and as well as to use the spectacles of correct power. Next is the washing your face. Each time after I advise and I suggest my patients to wash their face every 1 hour of digital screen viewing, because that hydrates your eye and that relaxes your eye. Because of the water temperature, as the cold water temperature, the eyes gets relaxed and and the tear film gets rejuvenated. And it's very important. This is very important. You need not go for using a detergent wash. You just need to wash your face with plain water, plain potable water. That will serve the purpose. Next thing, you can go for a hot compress. Just a dry cloth, putting in something or touching a hot object and go for a hot compress. Even if you cannot do that, you can just do a friction effect of two palms, and whatever the temperature is generated, just touch this temperature, the palm to your eyes. That will give that hot compress. Some form of lid massage with the help of earbuds. You can go for lid massage. This will, because there are the lipid layer is generated from the lids. So if you massage these lids, the lipid layer will be increased, and that will have an insulatory effect on the tear film and increase the stability of the tear film. So a little bit of lid massage is very important. And lid hygiene, because a lot of discharge will be there in the lid margin if you see monitors for a long time, and this discharge will block the glands and prevent the lipid layer to come out. So you need to clean your lid wipes or lid margins with your lid wipes or with a plain cloth, putting in a lukewarm water. Take a lukewarm water in a cup. Little bit you can put a Johnson baby shampoo, because that shampoo doesn't cause a lot of irritation. And with the help of a plain good cloth, just dip it and just clean the lid margins. That will serve the purpose. If all these things doesn't work, it's very, very important. You need to consult your local ophthalmologist and an eye doctor. He will find out what is the trouble is, and it's very important for identification of the condition as early as possible, so that we can treat it early, so that you can have a good vision. If you delay it, there are a lot of other complications may come. So to conclude, never ignore this problem of dry eye. Never ignore it. you have to early identify it. It's very, very important for early identification. At last, but not the least, give healthy respect to your eyes. So thank you very much for the kind attention. Hello. Hello. So the question is, children are using online and tuition game 8 hours per day. What is the suggestion, and any drop using regular basis help prevention? Yes, any form of lubricating drops will be available with the generic name of HPMC, hydroxypropyl methyl cellulose. These drops can come, you can go to the nearest pharmacy in the name of Max Moist. These drops will be coming. So you can use these drops. But on the contrary, 8 hours is a pretty long time. Try to restrict these children to 6 hours or 5 hours per day. So that will be my sincere suggestion. And as I said, after every 1 hour, wash their face with normal water. And after every 20 minutes of viewing, take a break of 20 seconds. So as I said, the question is, any special precautions and advice would you like to tell to minimize dry eye syndrome for electronic gadgets user? As I said, as I said about the electronic gadgets, the one suggestion in this case I would give to the viewers: whenever you see an electronic gadget, try to see in a big screen. For example, you want to see a movie, you better to try see in a bigger screen. As the screen becomes smaller, the strain on the eyes will be more and more. For example, if you don't have a TV, or you can just have a desktop. Buy a desktop. Desktop is also very, very healthy. And sometimes if you want to see the things in that mobile itself, then just Chromecast to your television to a bigger screen. In that case, you can see things. Whenever you see screens, a bigger screen, and the screen is away from you, at least 3 to 4 meters away from you, that relaxes your eye, and that doesn't strain much to your eyes. Exercises, as I said, exercises are very important. Any exercise for preventing dry, as I said, any form of physical exercises is very helpful, like having stamina exercises, like running for around half an hour, 15 minutes. It's 15 to 30 minutes. That will help you a lot to relax your eyes, because during that period your eyes are not working, your physical body is working. And always I say, there should be a balance between a mental energy and a physical energy. You should have always a balance. Your mind is always working, but your body is not working, you're always sitting. So you should always do a physical exercises, because that will have a balance. And during that physical exercises, your eyes are so much relaxed that it will rejuvenate your eyes for doing a lot of work. As I said, the COVID related to dry, COVID has created a lot of havoc in our personal lives. Is this COVID has created a lot of psychological problems, depressions, and the patients who have recovered from COVID have a lot of anxiety, post-traumatic stress disorder, depression, and because of loss of pay, loss of deep loss of their economic pockets. And this, what they do, because of the depression and anxiety, they try to hook to the screens. They eat a lot of bad food, and that eventually leads to obesity. And once you are eating bad foods, your normal cholesterol levels will increase. And once your cholesterol levels increase, then you will eventually have a dry eye syndrome. So in COVID related dry eye, in the patients who have already suffered from COVID disease, or who are in the home for a pretty long period, try to strike a balance in their life, have a mental balance and a physical balance. As I said, mental exercise and a physical exercise. Do some yoga practice that improves your core energy, and do some stamina exercises like running and doing a treadmill. That will definitely improve your dry eye syndrome. So I don't personally, I don't endorse as any eye drop, but any form of lubricating eye drops available in the market is good enough. So there are available in various brand names like Max Moist, as Aquas, like Atia. So many lubricating drops are available in the market. Hundreds of companies. So Max Moist Ultra, I give to a lot of my patients. It's pretty useful to a lot of patients. Yes, glasses is very, as I said, glasses is very very important. Glass, any form of digital screen viewing, I mean, you need to use your glasses. It's very very important. And without your glasses, never see these screens, because the screens emanate a lot of radiations, not only the light radiations but also the thermal radiations. These thermal radiations evaporate the tear film quickly. So any form of glass will have some form of barrier to prevent these radiations, these light radiations to come to your eyes, and thus will help in preventing the patients from having a symptomatic dry eye. So definitely glasses is very very important. And when you are using glasses, if the patient is having a power, if the person is having a power, the power has to be of appropriate power. Like for the 40 patients with above 40 years, is every 2 years this power increases. Like for 40, you have to use a +1 diopter, and for 45 you have to use a +1.5 diopter. So every person from 40 to 55, the transitional age, has different powers, and you have to use the power of appropriate power when you're seeing these screens. In common dry eyes, any the medications, as I said, the lubricating drops if possible. But as I said, without medications also, if you don't have an access to any pharmacy, as I said, if you are in mild symptoms, whatever the exercises, whatever the things I said, like lid massage, hot compresses, frequent washing of face, that will help. If those things doesn't help, still there is a lot of redness, irritation, and foreign body sensation, my sincere suggestion would be you need to consult your local eye doctor, to so that the exact problem, what is the exact problem, we need to investigate. And once we investigate, then we can give you the appropriate treatment. Over the counter medications, if you are not coming because of the pandemic, if you are not having access to the hospital, for the time being, you can use some lubricating eye drops. But as I said, if you have symptoms, we are doing all these native things like like hot compression, lid massage, and face washing, and using glasses. In spite of that, your symptoms are not getting relieved. I would suggest you to consult your local eye doctor. That will help you to identify the condition as early as possible. Yes, it's a very important question. Medications for LASIK surgeries, any form of refractive surgery, like when we do a surgery on the ocular surface, this eventually causes a lot of dry eye syndrome. I do a lot of LASIK surgeries. So whenever to my patients, once the LASIK surgery is over, I prescribe these patients lubricating for another 3 to 4 months. Even certain cases with uneventful LASIK surgery, uneventful cataract surgery, these patients will definitely will have dry eye syndrome, because the surface is little bit irregular during the initial 3 to 4 months period. During that period, the ocular surface heals, and if during that healing period patient requires some form of extra lubrication so that they can have a comfortable vision. And in spite of that also, the patient doesn't benefit with this lubricating, then again we have to go back to the examination, eye examination in detail, and find out any other causes which we are missing. So any form of LASIK surgeries for the initial 3 to 4 months, and so we need to use lubricating eye drops. Beyond that, if the patient is symptomatic, then he can continue the lubricating drops, and if he's not much symptomatic, he can discontinue, and whatever the other things, as I said, the exercises, washing, these things he can do for mild symptoms. But as I said, the LASIK surgery has no direct correlation with the dry eye syndrome. Initial 3 to 4 months, there he is there, 4 to 5 months, but after that, it is the pretty same. Even if he wouldn't have undergone surgery, the symptoms would have been the same. Yeah, young generation doing LASIK causing dry eye. Yes, as I said, the LASIK surgeries, a lot of people are undergoing LASIK surgeries nowadays, a lot of refractive surgeries. These people, at an initial post-op period, like the initial 3 to 4 months, they need to take little bit of precautions whenever they see screens, or whenever they do certain see visual like an IT professional. Most of the patients which I'm operating are IT professionals who have to work immediately after surgery for 8 to 10 hours. They need to give little bit of gaps in between. And I always prescribe lubricating eye drops to these patients for next 3 to 4 months, and give adequate gap in between the screens, whenever you see screens, at least like 2 to 3 minutes of break for after every hour, because that will help the eyes to rejuvenate. Once you do these things, I don't think you will have any problem. Post surgery, you will be very comfortable. So the question is, nowadays mothers of 7 8 months babies are handing the phones to the babies. But yes, this is very important question about the children. And in order to pacify them, like the small, the infants, whenever they want to, they are not drinking milk and they are not eating food. In order to pacify them, we are giving screens to them. That's actually very very bad. The reason is, it will delay their milestones, one of the thing. Their fine motor movements will be delayed. Second, because these screens, as I said, is harmful to the adults, it will be much more harmful to the children also, because these children also seeing screens continuously. They will be seeing screens, they'll be addicted to the screens, and children will be more addicted. They will have a more attraction towards screens, because that is more interesting than other things. So as parents, we need to make our children healthy, to keep our children healthy, so that we can this can be done by making other things interesting. So we have to allow the children to do other things, like playing, like building blocks, playing certain games, like physical games. This will be more helpful, more healthier for these kids. And never pacify your child, and by giving these screens, by especially the mobiles. That's very very dangerous. Yes, another important question is, this is very important question, issue in the evening time. Dry eye syndrome is basically more happens in the evening time, because in the morning time we are already had a good long sleep of 6 to 7 hours. During that time, the eyes are getting rejuvenated. In the morning time, you will not have much of problem. This problem usually happens in the evening time, because as the time passes, you are already tired. Your eyes are already exposed to lot of radiations, lot of work, and lot of things. So the evening time, and you will have more symptoms of dry eye. So my suggestion should be is, in the evening time, try not to see the screens as much as possible, at least after 9 p.m. Once you are having dinner, and after that, try not to see the screens. Avoid screens as much as possible. After the dinner, you can have a evening walk for 15 minutes. That will help your eyes to get rejuvenated. Whenever you're sleeping, don't see the screens till 11 o'clock and 12 o'clock. That will definitely aggravate your dry eye syndrome. So if you're having symptoms of dry eye, like I just had, itching, foreign body sensation, redness, watering, it's advisable not to see screens in the evening time. Yes, the LASIK surgery available in Berhampur. Yes, I have my LASIK machine, and I've been doing this LASIK surgery for around 7 to 8 years. And it is pretty good. The results are pretty awesome. People are so much of contented and relieved of their spectacles. They are very happy. Yes, LASIK surgery is a very promising surgery, and it is the future. It's the futuristic surgery, and I don't think, because as in LASIK surgery, before performing LASIK surgery, we always screen our patients whether the patient is having dry eye or not. If the patient is having any form of dry eye or any other systemic problem which has caused this dry eye, we try to avoid these patients for LASIK surgery. So we have a stringent screening procedure for patients before undergoing LASIK procedure. in COVID can do any cataract surgery on any? Yes, cataract. Yes, we need to take a little bit precaution. Any surgical surgeries during this COVID period, we need to be very careful because the patients may transmit the virus to the paramedics and the doctors. It is whenever we do perform surgery during this COVID times, we take adequate precautions and we need to screen this patient, triage this patient. If the patient is having cold, cough, or anything, we avoid these patients for surgery for the time being. They can come as soon as their symptoms are over, and we can. The patient is having certain symptoms which is diagnostic of COVID, then they needs to be screened for COVID like RT-PCR or from any form of antigen test. And once the antigen test is negative, then yes, we can go for cataract surgery. The patient is fine, then we can go for cataract surgery, no problem during the COVID period. Yeah, lubricating drop using regular. The question is whether any person can use regularly lubricating eye drops. Is a very important question. Any lubricating eye drops which is available in the market has certain preservatives to preserve that molecule. These preservatives are again detrimental to the ocular surface. Long term use of lubricating eye drops is not good. It needs to be advised by an eye doctor, because these lubricating eye drops itself has certain preservative. How much ever they say, the companies say that there is no preservative, but still there are certain preservatives to keep that molecule, to keep that vehicle, to keep that drug molecule inside that bottle. Because once you open the drop, you have to use it you can consume it within 45 days. So to keep the drop for 45 days, you need a preservative. And when you are using preservative eye drops for a long period, that may aggravate the dry eye syndrome. Nowadays, preservative-free eye drops are also available in the unions, in the form of unions. That may help in some way. But any persons who is using long-term lubricating eye drops need to at least consult their eye doctor whether the problem is genuine, whether he can use the lubricating eye drop for this long period or not. How many times any lubricating eye drop we need to put in the eyes? It's a very important question. It should not be more than 3 to 4 times a day. I don't suggest more than 3 to 4 times a day. If the more than that you're using, the preservative may cause side effects. Maximum 3 to 4 times per day. And if that doesn't help you, we have to go for some alternative medications, and we have to check what is the other problems are. Like there is maybe a lipid abnormality nowadays. In my hospital, so I've been using certain IPL therapy for the patients who are having a lipid abnormality. As I said, the tear film has 3 components: the lipid component, the aqueous component, and the mucin component. The lipid component is sometimes the patient has 90% of the patients have unstable lipid layer. So in order to improve that lipid layer, we have to do certain other methods also, like the IPL therapy. This is something like a light therapy. There's a light, it's a high temperature light which stimulates the glands surrounding the eyes to increase the lipid layer. And one sitting can 1 to 2 sittings, like in a gap of, I give 2 sittings in a gap of 15 days, that works for 6 months. So whenever you're using lubricating eye drops for a prolonged period of time, you need to identify what is the cause of the problem. Unless until you identify the cause of the problem, how many months you use these lubricating drops, it will be of no help. If you have a lipid layer abnormality, these lubricating drops may not help. So you have to address the issue of lipid layer first, then only you can treat this dry eye syndrome. The best lubricating drops, any lubricating drops which is preservative free is good enough. So there is nothing I may not endorse. It will not good. But Max Moist Ultra, which is from the House of Ajanta, is working very well. So there are a lot of molecules inside that lubricating eye drop which works very nicely on the ocular surface. But personally, I don't endorse any form of lubricating eye drops. Any preservative-free eye drop is good enough. Yeah, another very important question: in night using digital gadget, mobile in dark area, it's good or not. It's very, very bad. Whenever you see a screens, either a mobile or a television or a laptop, it is very good. It is very important to have a good light ambience. The light ambience reduces the eye strain, and whenever you see the screens in a dark atmosphere, the radiation effect or the light radiation effect on the eyes will be much more. But when you are having a good light ambience, this the radiation effect or the light effect will be little bit less, and that comforts your eye. So it's very, very essential. Never see the screens in a very dark atmosphere or a dark ambience. It's better to see in a pretty good light ambience. Age limit, yes, very small children like less than 2 years, these lubricating eye drops has not been studied whether it is efficacious in the kids or less than 2 years or 3 years of age. Beyond 3 years, yes, 90 years, no problem, but less than 2 years, we need to be very, very cautious to prescribe lubricating eye drops because this has not been studied properly. So it's better not to give lubricating eye drops in very small kids, like in the infants or up to 2 years of age. Driving it's a very important question. There is one of the person is telling, if you are driving, what are the precautions you need to take. Driving is a very, very challenging job, especially when you are driving in the night time, and if you are having a dry eye syndrome. As I said, any dry eye syndrome has a symptom of higher light sensitivity. And when you are driving in the night, when the light is falling to your eyes, if there is increase in the sensitivity of the light, it's very important to, you need to consult the eye doctor to see whether you are having any dry eye syndrome. Nowadays, the dry eye syndrome can be quantified also. There are certain machines where we can quantify what is the amount of dryness you have. And for the suggestions who are driving in the night and who are driving heavily, you need to take adequate breaks, and you need to use glasses. If you are having a power, you need to use your glasses. And for the two-wheelers, basically for the two-wheeler drivers, you need to use some protection like a helmet or glasses while driving, because the wind which is coming to your eyes can hit certain foreign objects to your eyes, which is very dangerous. So some form of protection is very important, one thing. And the wind can cause the evaporation of the tear film, and that may cause the dry eye. So that's why any form of protection is very, very advisable for the two-wheelers. And for the four-wheelers, because windshield is there, and if you are having a lot of light sensitivity, then you can take a little bit of breaks in between, and you can use lubricating eye drops especially when you're driving in the night time. Radiation, this is something radiation. So there are various radiations. The term radiation is a very general here, the general term, because we need to specify what radiation is. This light radiation and thermal radiation from the emanating from the monitors, as I said, you have to use these like the spectacles and some form of desktops and all these things. But other radiations, like the patients, certain cancer patients who are using who have undergone radiotherapy, they have a very high incidence of dry eye, because the radiation which is used to kill that cancer, that radiation has a strong effect on the lacrimal glands here, and that completely gets destroyed with the radiotherapy which we are using. And that these patients will have very, very high incidence of dry eye syndrome. And these patients who have undergone radiotherapy for cancer, and so definitely need to consult their eye doctor, definitely. And as I said, the radiations from the screens, these are the whatever I have said in the presentation, you need to follow. I think we don't have any other questions left. Ayushi, are you here? Should we sign off? So thank you very much, all the viewers of the Facebook, for this very, very interactive session of dry eye syndrome. Hopefully, I have cleared certain doubts which has been propping up in your mind. And at the end, I would like to say, give very, very healthy respect to your eyes. Never ignore this problem. It's very, very important. early identification is again very, very important thing. If you are encountering like itching, irritation, and foreign body sensation, please consult your local eye doctor, because he can identify this condition as early as possible and will give you treatment appropriately. So thank you very much for the kind attention, and be safe, stay healthy. Thank you very much.